Welcome back. The COVID-19 pandemic is first and foremost a medical issue. We have with us in the studio now Dr. Andrew Bushnell, and Medical Director at Rome Memorial Hospital, and Dr. Kent Hall, Chief Physician and Executive at Mohawk Valley Health System. Both of you, thank you for joining us.
Thank you. Thank you, Thomas.
First of all, we want to reiterate to those who are watching, to make it clear to the viewers, what is the proper protocol on how to get tested and where to get tested?
Well, I think the simple thing is to call your physician, and your physician will direct you through the Oneida County Health Department to get tested at a site that is near your location. So we have a site in Rome. Dr. Hall, you have a site also, right?
Yeah, we have a site also in Utica, and I can't agree with Dr. Bushnell more. It's really very important. Your primary point of contact should be your primary care doctor.
And how should someone know if they should be tested for COVID-19?
So that's, I mean, COVID-19 is a virus, and it's a respiratory virus, which means that you get respiratory symptoms. You get a runny nose, a sore throat. Probably the biggest thing is when you get those in conjunction with a fever, and that you have had an exposure that is believed to be from COVID-19, whether it's related to travel or whether it's related to somebody that you've been in the community with, who also would be a possible person of, who has been infected, then those are the keys that would say, this is something that I think that I need to be tested for.
And I know we're constantly learning more about this virus. Have we found any information yet on how long it can live on certain surfaces?
From what I've heard recently, it can live on hard surfaces at least 2 to 3 days, if not longer. So we're still finding out more about this virus.
And the tests themselves, is there any possible case of, say, a false positive or a false negative?
So the tests are actually very good as it relates to that, especially the false positive rate is actually very low. I would say that the false negative rate is also very, very low. That's much more dependent on how well you can actually get the specimen from the individual.
And is it possible to be a carrier of this virus, to be asymptomatic, but potentially be able to carry it on to someone else?
Definitely. So there are people that are asymptomatic that test positive. We're treating everyone as if they potentially are a carrier. Most of our hospitals in the region are looking at visitor restrictions. I know at Rome we are requesting that if you don't have a particular need to be at the hospital, please don't visit. Because you may bring that virus into the organization. In addition, when we talk about testing, if you're really sick, we expect you to come to the emergency department. However, if you're just having cold-like symptoms, the emergency department is not the place to go to get tested. We have a limited number of resources at all of our hospitals nationwide, and those folks that are coming to the emergency department just for a test will overwhelm the system and perhaps contaminate the healthcare workers. So we want to restrict that as much as possible and say, stay home. If you're sick, drink plenty of fluids, take care of yourself. We expect to see you in the hospital when you can't breathe, when you're having difficulty with your breathing, or for all the other emergencies that we take care of on a day-to-day basis, heart attacks, strokes, everything else.
And to bring back that point about carriers, is it attached to any particular demographic or age, or is it just a case-by-case basis?
So there is some data that would show that children seem to be particularly prone to being carriers without symptoms. That's still very early in its knowledge, so we don't know for sure exactly how that's going to expand, but that is what it looks like for now.
And for both of you, we would be remiss if we did not mention there's so much misinformation there. In fact, I just saw on Facebook about a day ago that someone was claiming that you can gargle hot salt water and it prevents the coronavirus even if you have it. Things like that to just make clear to viewers what are the most reliable sources to get medical information from.
I think there are two. One is cdc.gov and one is the Department of Health, New York State Department of Health website. Both of those are very reliable and very good. I
would absolutely echo that, and anything that you're getting out of Facebook or anything like that has to be looked at with a pretty jaundiced eye.
And finally, before we leave you, what are the things, the simple things but important ones that people can do to prevent their chances of contracting this virus?
So the most important thing is what you hear all the time. You want to wash your hands. You want to not, be shaking hands. You want to not be touching your face. You want to be keeping distance from people. The current recommendations are 6 feet. Those are the kinds of things that are really very important.
Agree. Complete social distancing. Avoid any gatherings, as the governor has said, of more than 10 people, and try and limit any social interaction.
Well, thank you both. We'll have more with them after the break, along with another health official. Stay tuned.